Hey there, welcome to the Thriving and Wellness Podcast with Haley and Caitlin. This podcast is for women who are tired of just surviving and ready to truly thrive. It's time to reclaim your health and build trust in your body.
Join us as we myth-bust nutrition topics, tackle your mindset, and dive into the nerdy side of women's health. Just a reminder that this is meant for educational purposes only and is not meant to be used for medical diagnosis or treatment. Now let's jump in.
Welcome back to the Thriving and Wellness Podcast. We are talking about something that's pretty popular right now, and that's going to be weight loss medications, more specifically Ozempic, the GLP-1 medications. So this is something that has been on the rise recently. Who knows if it has any end in sight with its popularity, but I personally work with a lot of people who are on this medication, a little bit for weight loss, but mainly for diabetes. And we thought it would be a good topic to discuss a little bit more in depth, because I feel like when you see it online, it's always so, of course, in the online world, always so polarizing. So we're going to be talking through kind of what is the medication, our thoughts on it, some pros, cons, what we've seen happen with people who are taking that medication, just some thoughts. So why don't we start off with just explaining, because a lot of people are familiar with it probably, but might not know what that medication actually is. So what is Ozempic or the GLP-1 medications, and what are they doing in our body?
Yep. So the type of medication that it is, GLP-1, that is a hormone. So it's glucan-like peptide 1, and it's a hormone that's in our gut. It stimulates insulin secretion. So insulin is what helps bring our blood sugar levels back down. And then it inhibits glucagon release, and that's what helps increase our blood sugar levels, like when we're in a period of fasting, or if our blood sugar dips too low. So that's how it kind of affects some of our other hormones. And then it slows gastric emptying, which promotes that feeling of fullness because things aren't moving through your digestive tract as quickly. So that is, that's where it can like really help with people who have diabetes when it's affecting those hormones. And then because it's promoting that feeling of fullness, it can, in that aspect, support weight loss. Which obviously affecting our other hormones is going to in turn affect weight loss as well. But I feel like that like feeling of fullness is a benefit that I hear from my patients who kind of have that like constant food hunger. And they say it's just like the noise really quiets down once they start one of these medications, and allows them to, be in a calorie deficit easier than they've been in the past.
Yeah, that's something I hear a lot for the people, especially ones who are taking it mainly for the weight loss, is that it just calms the intensity of cravings and that constant hunger. Because there are some people where our appetite and satiety hormones are off. Like there's a lot of things that can influence those.
Right.
So like our leptin and things like that. And so it can be a really helpful tool for those people. And then, of course, like you said, people with diabetes helping with the blood sugar aspect, but oftentimes the weight, because with people with diabetes, we're talking about people with type 2 diabetes is where this medication would be utilized. And oftentimes weight is also a concern with those patients too. So we're actually not against this medication, right? I think I just saw someone post today about their hatred for this medication. It was another dietitian, and you probably see a lot of that online. But I don't think, like, really with most medications, I think there's a time and a place to use them. But also with most medications, well, really all medications, like this one, true, it's not a miracle drug. And that's kind of what we're going to talk about today, because oftentimes the way I see it portrayed, or even the way I hear some people talk about it, as if they're interested in starting that medication, is they think that's like the golden ticket. That's the thing that's going to make all their problems go away. It's going to solve all their concerns with weight, blood sugar. And while it can be an extremely helpful tool, like we just talked about with like taking the edge off and getting the needle moving, we still need to make diet and lifestyle changes to support. And again, like this is with really any medication, we always want to make sure our diet and lifestyle is still supporting that goal of what the medication is trying to do as well.
Right. And I mean, thinking about like gastric bypass surgery, which is like way more extreme than this, and that's something like lifelong. At least, you know, a medication like this, you can stop it at some point, but like once you have gastric bypass, you're kind of done. But like even for people that go through that surgery, you still have to be making the lifestyle changes. And I've worked with a lot of people after the fact. They're like, oh, I didn't realize that I was still going to have to work through like all of these emotions
Yep.
and still make all of these other changes. So yeah, it's definitely not like a magic pill. You know, it is a more of a quick fix, you know, like it's definitely going to expedite the process, but you still have to put a lot of you know, time and effort and make those lifestyle changes, especially for to be able to maintain the weight loss once you stop the medications.
Yeah, and I know we were planning to put this at kind of like the end of our conversation. We'll probably remind you too, but I want to just throw out there, like, if this is something that you're considering, interested in at all, we just highly encourage you, and that's kind of why we're putting this information out there, is to kind of give you an introduction to some of this and get your like the wheels turning, get you thinking about it. But I think it's really important to have a really in-depth conversation with your doctor. Like what will this medication actually do for me? What are the results we can expect from that? What are some of the side effects? And again, we'll talk through some of those and what we see in practice as well. And just make sure you're really considering everything, and also long term, like what's the plan? Is this something I'm going to stay on forever? Is this a shorter term thing? So taking all that into consideration rather than just having tunnel vision of like, I'll start this medication, I'm going to lose some weight and everything's going to be great, right? So let's talk a little bit more about kind of our experiences, what we've seen in practice working with the people that are on these medications.
Yeah. Well, first, I want to point out that the medications don't work for everybody. I think so often people think like they just see everybody out there that are on these meds and it's like, oh, this is going to be the game changer for me.
Yeah.
But because we both work with so many people who are already so severely under eating, it's not really going to work great for people who are already only eating, you know, 800 to 1,000 calories, because I mean,
Yeah, because
you can go much more than that.
exactly. And that's one of the big side effects and cons that I see. Again, all these, it's everyone's individual. Some people thrive on these medications. Other people are unfortunately miserable and don't see the benefits. So what I often see is one of the challenges is that reduction in appetite. While that's one of the purposes of the medication, like we talked about, to take that edge off and to help you get to a calorie deficit, that is needed for a lot of people. But for a lot of other people, especially as we get into higher doses of this medication, I see that their appetite decreases so much, so to the point that it's challenging to actually meet your nutrient needs, right? And so especially protein, because protein's so filling too. And so that just feeds into you feeling fuller longer and then not wanting to eat. So I see people start to skip meals. They're just like not hungry, which is great in some situations, but we still need to make sure you're eating consistently, because we don't want to have the negative impacts on your metabolic health, and still make sure you're supporting your overall health. Because so often that's the whole purpose of wanting to lose weight for so many people, is supporting their health, right? And so we're kind of missing the mark with that.
Yeah, for sure. Yeah, I have seen lots of people feel so awful that they can't eat anything.
Mm-hmm.
And it's really hard for them, for some people, you know, especially when they're like, well, I'm already not eating a lot, then to go to this, like, they don't notice how big of a difference it is.
Mm-hmm.
Um, or, just like the lack of eating isn't as like in their face. But people who do have a lot of that food noise, then to switch and not feel hungry, and then they're working with me and I'm reminding them like, okay, you need to
You
be
should eat.
regularly. And it's so challenging for them because they've never had to like think about eating, because
Mm-hmm.
that thought is always there. Like
Mm-hmm.
it never goes away. And so then they start this med and they're like, well, I forget to eat, and that's never happened before. And like how it's like this whole brain switch, and
Yeah.
they feel
Yeah.
so confused.
I've had a couple people recently too, where because they've had that reduction in appetite, it's like they're in the moment, they're so used to ordering so much more food. And that's weird for them. Like I've had people say, like, especially if they're surrounded by people who are used to eating larger portions too, they're like, I have to remember that it's okay that I don't eat as much as them. And
Mhm.
in this scenario, these two scenarios I'm thinking of, they're still eating plenty. They might still actually need to reduce their intake a little bit, but it's been such a drastic shift for them from these large portions of constantly getting to the point of being overly full, because that's what they're used to be able to kind of shut that messaging off, shut that constant thought pattern of I need more food off, right?
Mhm.
To now having more typical portions, a healthier size portion that actually gives them their nutrients. But that is not always the case, but it is an interesting thought too. And just
Yeah.
another important reason why like diet and lifestyle and mindset work are still incredibly important along with this.
Yep. One thing that I've seen that helps people be more successful with being on a weight loss medication and having, better success long term, is when they do allow themselves to still have what they feel like are like some of their treat foods. So like
Mm-hmm.
still having some sweets and desserts, maybe even having a little bit of alcohol, when they're on it. Because sometimes their initial mindset is like, I'm on this weight loss medication. They do that whole like all or nothing
So,
thing.
yep.
I am all in, but then they feel so restricted, even though they're not necessarily feeling tons of hunger and having really strong cravings. They still feel like, oh, well, I'm not supposed to have these foods that I really enjoy. And so then when they allow themselves to just have a cookie or, a couple bites of ice cream, they're like, that's all that I could eat. And I felt satisfied in that moment. But
Mm-hmm.
like mentally, it helps them feel, that satisfaction is just so different.
Yeah.
And
Finding
so
that
then
balance.
when they come off the medication, they don't feel like, well, it's been months or maybe even like a year or so since I've had any of these things. It's a lot easier for them to kind of moderate their intake around those foods.
Yeah, and I want to go back to the reduction in appetite because I would say more often than not, the challenge I see is people are so interested in weight loss, and that's a big reason why they start these medications. So when they have that reduction in appetite, even if it's significant, and then they're seeing the scale change, even if they're eating like 800 to 1,000 calories, they're like, I'm not hungry, so I don't see why I should be eating. Right. And so that's a big challenge when I'm working with these clients is making them understand the importance of actually getting it. So we talked about just nutrient needs in general, but what does that actually mean? And the reason why we need to make sure we're eating enough is, I mean, there's so many reasons. One, getting all your vitamins and minerals, but rapid weight loss, and especially if you're doing it with cutting down those calories so significantly, and to like that really low 800 to 1,000, you're not getting nearly enough protein. You're going to have muscle loss.
Right.
And that's going to negatively impact your overall metabolic health. And again, that's opposite of kind of what we're looking for. So down the road, that could make keeping weight off more challenging. That can make blood sugar support more challenging. Like muscle mass is so crucial to our metabolic health. We need to really focus on that body composition. And then another thing I wanted to throw in here too is this is something you and I have kind of like speculated and discussed, is that, and we've seen this a little bit more, we're testing kind of this protocol with some of our clients, is that there's a lot of people who they put so much of a burden on their liver, and our liver actually plays a huge part in our metabolic rate and how our body's able to kind of process these calories. And so the liver needs a lot of these vitamins and minerals. It needs adequate protein, magnesium, all these things to function properly. And so if we're already at a state where maybe the liver is overburdened from other diet and lifestyle factors, and then that's leading to some of this weight loss resistance, and then we start a medication that's putting us more into this nutrient depletion, like that's not going to be supportive of our liver, our detox pathways in general, overall.
Yes, absolutely. Yeah, and again, I feel like it's so conflicting to people's, we've spoken so much about like our brain and our thought patterns and our mindset. But it's such a mental switch to start a medication that's supposed to decrease how much you're eating, and then you have to be very intentional about making sure that you're eating enough.
Yeah, and honestly, is a fine line for a lot of people, right?
Yeah.
Like we don't want to then go overboard where you're stuffing yourself and feeling like you have to force yourself to eat. So that's where working with someone on this medication as a team, like figuring out where you can sprinkle a little bit more nutrition in, and maybe starting a multivitamin. Like
Right.
I don't usually make blanket supplement recommendations, but in a lot of these cases, at least starting a multivitamin can be a backup plan to help fill in some of those nutrient gaps or prevent more of that depletion.
Yeah. Yeah. And kind of circling back to like the muscle mass loss that you can have when you're on, it's not necessarily that because of the medication, it's from like being in such an extreme calorie deficit.
Exactly. Yeah, that's a good clarification.
Yep. But incorporating strength training activities while you're doing this to try to at least minimize the losses as
Yeah.
well.
I feel like we've been really focused on the negatives. I promise we'll bring in some more positives here, but one other thing that we wanted to bring up is those GI side effects that can come along with it. I've seen the varying degrees with people. Some people are very nauseous and have lots of GI issues with diarrhea. And that's definitely impacting their appetite too. But I would say more often what I'm seeing is the constipation, because it's just throwing, like you said earlier, like it's slowing everything down.
Right. Yeah. And I've seen like almost debilitating nausea, especially when
Yeah.
people are increasing their dose. So the first, 1 or 2 times that they're at that higher dose, it's for, 2 or 3 days where they're just struggling to make it through the day.
Oh,
Because the
yeah.
nausea is so bad.
Yeah, I have this one client who actually has a continuous glucose monitor, and each time she's increased her medication, I think she's on Mounjaro. So each time she's increased it, which has been like 2, 3 times now, like for a few days afterwards, she just literally can't eat anything and her blood sugar plummets. Like she's in the 50s and 60s overnight. I was like, we need to get something in you, but she just can't keep anything down. So unfortunately, it kind of resolves after like the first increased dose, but yeah, that's a big challenge.
Yeah. And so those are like, some of the immediate side effects from being
Mhm.
on this, that like nausea, sometimes diarrhea, but usually constipation. But with that delayed gastric emptying, there's increased risk for other digestive problems. So it could lead to, dysbiosis of gut bacteria. It could lead to SIBO, which is small intestinal bacterial overgrowth, because things aren't moving through the GI tract the way that they're supposed to.
Yeah, and I will say, like, this is a newer medication that's definitely gained popularity recently. So I don't think we have a lot of great long-term, I don't want to say we don't have any long-term studies, but just like working in practice, we don't see kind of how this impacts the gut and everything long-term. You and I have talked about this. I've talked with a few other colleagues about this and some of these potentials, like you said, just without a medication, seeing that slow down in the digestion can lead to some of these. So it will be interesting. I mean, fingers crossed, hopefully no one has any horrible negative side effects from it, but it will be interesting to see kind of like the long-term impacts on gut health for people who utilize these medications.
Yeah, absolutely. What would you say are some of the like pros of taking a medication like this, or when are times when you're a little bit more in support of somebody starting?
Yeah, I would say I'm more so supportive of this when it's someone with type 2 diabetes, honestly, to bring their A1C down. I've seen some incredible results. So as a diabetes educator, I work with a lot of people who do have type 2 diabetes, and they've seen such a drastic decrease in their A1C. Unfortunately, like as a whole side note, but unfortunately, then their insurance pushes back. It's like, oh, your A1C is good now, so you don't qualify for this medication. And so their doctor's having to go back is like, the whole reason their A1C is down is because they're taking the medication. So I think that's a whole, like, hopefully that gets worked out. But I just know that like at this point, there is a shortage of a lot of these medications. So I think that's why and it's expensive. So that's why some of the insurance companies push back on that. But yeah, so definitely with type 2, I've seen incredible results for a lot of my clients that I've worked with there on that. I would say someone who has a significant amount of weight to lose. So definitely not for someone who's got like 5, 10, 20, even like 30, 40 pounds, I probably wouldn't recommend it. But for someone who's maybe got like 60, 100 pounds to lose, a significant amount, and they've tried a lot of different things, right? Or someone like we talked about that just has that constant food noise, and it's really challenging for them to get into that deficit. I think it's worth talking to their doctor about and considering, because they may or may not be, but most likely at a higher risk of diabetes and higher blood sugar levels. So that's something to consider too. So I think in those situations, it's important to consider. I don't tip it if I do see that someone's significantly under eating already. If I can talk to them prior to starting the medication, I would definitely have some hesitations just because I've seen it reduce the appetite even further.
Yeah. I will say if somebody's having a lot of food noise, I think it's important to also make sure that there's no eating disorder at play there, because obviously if there's an eating disorder or even like really extreme disordered eating patterns, neither of us would ever recommend a weight loss medication. We want to make sure that that's under control first.
Yeah, and I think that's a misconception that we just talked about in another recording, is that eating disorders or disordered eating is only in people with a smaller, or people in a smaller body, but it can definitely happen in people in larger bodies too. So if you're in that place, we highly encourage you to seek support, seek guidance with that, and definitely address that first. So a lot of people will like jump to like, I need to start this medication, like I need this help, right? And I don't know if it's because people don't fully understand what the medication does, but like as we talked about earlier, it really helps with the GLP-1, which is a naturally occurring hormone we have in our gut. And so that means there are some things that we can actually do, whether you're not able to get the medication or maybe it's just not a good fit for you, but you want to help increase satiety and help with the blood sugar. There are actually things that you can implement, certain foods and things to incorporate that can help with that increase in release of the GLP-1.
Yep. So some of those foods would be like saturated fats and monounsaturated fats.
Mhm. Can
Protein.
you expand on that? Because I think like we talk about that all the time, but I don't know if a lot of people know the difference between the two and might have some fear around saturated fats.
Yes. So saturated fats would be, I mean, that's going to be primarily in like animal products.
Hmm.
And like butter is a great source of saturated fat. And then monounsaturated fat, that's going to be like your avocados and your olive oil.
Hmm.
Those are the main ones that come to mind.
Yeah, I think of, you said, did you say avocado? Sorry, my mind was thinking about the saturated fat still. So avocado, if you didn't say that. I want to add something with the saturated fats. Like we're not encouraging you to just like go down butter, like putting it in your coffee or something like that. Although I've
Yeah.
definitely done that and I had that phase. We still want to be mindful of our saturated fat, especially if cholesterol is a concern for you, but we don't need to be fearful of saturated fat as we once thought we needed to be. So the most important thing is just incorporating adequate amounts of fats in a mixture of these types of fats.
Yeah, well, I'm thinking about like the other animal proteins. Like we don't need to just be eating like chicken and turkey because they're the leaner.
Boneless, skinless chicken breasts that have no flavor.
Yes. Like yeah, it's okay to eat some of the darker meat or to include like pork or red meat
Yeah.
because there are going to be some benefits with the saturated fat that's in there. So okay, let's not, swing to the other side. Of course, we need balance in all of the things.
Yeah, of course. Always got to put that nuance in there.
Yep. Um, so yes, protein, whey protein is going to be one of the best options. So whey protein is one of the primary proteins in dairy products.
Mhm.
And then whenever I'm suggesting protein powders for people, if they tolerate whey or dairy-based proteins, then I have them go with a whey protein powder. And then obviously we go with more of like a vegan one if they're not able to tolerate that.
Yeah. So if you are someone that doesn't tolerate dairy or whey protein specifically, or just dairy in general, really just increasing your protein intake
Yep.
overall,
Yep,
right?
for sure. Yep.
Um,
Good.
well, I was going to say the next one too, I think is interesting talking about like the detox aspect of it and liver. So this other one is bitter foods. And
Mhm.
so often we're encouraging bitter foods, and this is like dark leafy greens, some people use like actual bitters, like digestive bitters, right? There's so many different foods, but these bitters can actually help with supporting the gallbladders, help support with bile production. So that ends up helping with that detox process and then ultimately digestion as well. So I think that's an interesting one that also helps with the GLP-1.
Yep. And then flavonoid rich foods. So flavonoids is a type of antioxidant. So that is kind of a lot of different foods. But like your berries, dark chocolate. Why is my mind like blanking on all of the
See,
flavonoids?
that's how I was with bitter foods. I'm like, I talk about this all day long, and now I can't think of anything. I think in general, when I think of flavonoid rich foods, it's like I'm thinking of color, things that are like rich in color.
Yeah.
Obviously dark chocolate's not like rich in color, but like similar with the bitter foods, we're thinking more of those like vegetable type things.
Yeah. Um, arugula,
Yes.
turmeric, ginger.
Artichokes.
Hmm.
Yeah,
Yep.
definitely all those. What else?
Yeah. So
I had one on the tip of my tongue that I was like, oh, that's a good one. And now I've blanked. So move on.
Um, but yeah, I think it's great to know that there are ways that we can help stimulate this hormone, just naturally with the foods that we're eating. And it really shows how, like, if you're eating something, that is nutritious, um, and colorful, and that's what you're eating, you're going to feel more full from that than if you're eating, something that's maybe a little bit more carb heavy and is lacking in the color. And so there is the blood sugar piece with that. But also this hormone, and you're probably eating more volume when you're including more, color and variety and all of that. So there's like multiple different factors that come into play that can contribute to this feeling of fullness.
Yeah, exactly. And I would say in general, we got specific with these types of foods, but this is typically how we recommend people eat to, like you said, support blood sugar and overall health. Like the bitter foods, flavonoid rich foods, those can be really supportive of your gut health. The protein, that's always important for muscle mass, blood sugar, right? And then the fats are really important for satiety and blood sugar, as well as our hormonal health. So they have all these other benefits. So in general, don't need to overthink it, but we wanted to give you some options for things that you could consider incorporating maybe more often to help with that satiety, if that's something you're struggling with.
Yep. So, overall, to kind of wrap this up, there are definitely times that we do recommend this medication, and then some other pieces that you definitely want to take into consideration if you're thinking about starting one of these. And if you are going to start one, making sure that you have somebody to support you in the lifestyle changes necessary while you're on the medication, for sure, but also as you come off the medication, so that you can have that long-term success.
Exactly. Yeah. So obviously as dietitians, this is not something we prescribe, because we can't prescribe, but we will have a conversation with our clients about it if it's fitting. So definitely talk to your doctor about it. But I think this is something that's going to be maybe an ongoing conversation if it continues to be popular and we see it prescribed more and more. So if you have any questions on this, or just maybe want to chat more about it, we're happy to talk to you more. So feel free to reach out to either of us on Instagram at Dietitian Haley and Dietitian Caitlin, and we will see you next week.